Hi guys. Hi, I am Dr. Martins, Dr. Ngm for short, and this is my week 9 of 52 weeks of housemanship. Yay! This is my last week in cardiothoracic surgery unit, and a lot has happened. A freaking lot has happened. In total, in my cardiothoracic surgery unit rotation, I was able to do 3 thoracostomy, I was able to do thoracosynthesis, and I still perfected my skills. I'm super proud of myself, actually. So, cardiothoracic surgery unit here, I think I've had the best experience so far in cardiothoracic surgery unit because, I had the most beautiful set of people to work with. My regis, even the regis of other departments, because, you're in cardiothoracic surgery and you have consults in different units, general surgery and the likes, And I think, I'm super grateful to have come in contact with them. They were very positive, very encouraging, and all of that. So, for that, I'm super grateful. Down to my consultant. Now, my consultant is a very special someone. Yeah, she's a female, and I so admire her. I so admire her. I got to know of her when I was still in school. Apparently, if you're in Christian Medical and Dental Association, you should know her. Yeah, and you're in FETA or you're schooled in FETA, you should know her, So she was my predecessor in CMD. I was the financial secretary and she was my predecessor, and I got to invite her for one of our programs, and she came and she did a very beautiful work. Her talks, the word she gave to us that day was just superb. So from that moment on, I already started admiring her. I didn't know I would get to meet her here. So yes, we had a surgery to do. My consultant came in and she reviewed the patients. I can remember that they being in the theater with them and them discussing about the patient, how best to avoid possible complications, how best to go about the case, and it was just mind-blowing. It was just superb for me. Do you get? Funny enough, the anesthesiologist on the case too was female, so seeing my consultant female, there are also other females around, I was just I was over the moon. Do you get? You don't get to see a lot of females. I haven't seen a lot of females in other departments and all of that, so seeing them in that hour, at that moment, it was such an inspiration to me. And for that I'm super grateful. We did the surgery and everything was just beautiful. Patient is stable and all of that. So yes, I'm super grateful for that opportunity to have been in the same OR with her, literally. So so hi guys, today we are doing another thoracostomy. Stop looking at me. Today we are doing another thoracostomy. This is my chip. I don't know why he's sticking in. But hopefully I get another opportunity to do this one. And I'll talk to you guys when I'm done. I can't possibly show you guys the step-by-step procedure again because you have to what's it called, protect patient's identity and all of that shit. But I'll talk to you guys when we're done. Hi guys, I just did my second close to thoracostomy drainage and I'm freaking tired. This is 8:35 p.m. in the evening. So we had 2 cases. My chief did one, I did one. Yay! For me, and I'm tired. Today was something else. We had a lot of patients to see during the ward round, and that's just us. Currently writing post-op notes. That's the boring part of the work. I'll catch you guys later. Talk to you much later. Probably when I'm settled at home. Funny thing is there's no food at home currently, so me going back home I have to go and find food to eat, and the people here that cook I don't think they cook good food, so there is no proper food outlets that is around the hospital here. So probably have to settle for Indomie this night. Annoying me. Their funny looking pen has a red on the up, has a blue down. No, has a red here, has a blue up. Weird. I'm joined together by some tape. Cute. Efficient. We are done. See my baggy, what is it called? Run inside the toilet, literally. So my baggy scrub, yeah. So I'm tired, I'm exhausted. 2 CTTD done today. I'll catch you guys later. See how this ugly is staring at me. Peace. And a very fine nurse that assisted us today. Thank you very much. Yes, I'm changed. Yeah. And I'm heading home. So today I did my 3rd thoracostomy drainage, yeah, and it's been one hell of a beautiful ride. So apparently it's here. So this human came to watch how thoracostomy is being done, and he got trapped to assist in the surgery. Same procedure. I don't know, I wouldn't say that I'm going to cardio-thoracic surgery unit now, but looking at it, it's looking like one of my very most likely specialties. Well, yes, it's looking like my most likely specialty, actually. I don't know, I know it to be very demanding and all of that. Well, I haven't gotten into the theatrics of it all, but yes. Now, don't say that every single rotation I get into, I want to specialize in the units. It's more like that. I just find something to love about every single unit, and I think that's what makes the rotation or the posting for me really beautiful. Do you get? In orthopedics, I've always been in orthopedics rotation in school. I enjoyed my orthopedics teacher, Dr. Agamigo. Like, I had a really beautiful set of people there, yeah, and they taught us pretty well, so it came very naturally to me. And then I had my chief consultant there, who was also a female, so that was also another inspiration. Do you get? Then coming down to urology, I had very beautiful set of regs, senior reg to work with, and it was really beautiful. I also had a thing for urology in school, yeah, like it was fascinating to me how things work literally in urology, and it came also naturally to me. Catheterization, bladder washouts, irrigation, and all of that, it came really naturally to me. Do you get? Then I went down to pediatric surgery. Now this one was somewhat different, but I loved pediatrics in school. Do you get? And I love surgery, so combining it wasn't so hard. It's just the particulars about children that was a bit challenging. You get? You have to know their dosage, you have to calculate their specific medications. Do you understand? So those kind of things, those were the other sides of it. But yeah, I was able to pull through. Then down to cardiothoracic surgery units. I don't know, I think like this is the peak of my rotation. Let's see how my last rotation does, do you get? But then cardiothoracic surgery unit, I was able to gather so much skill in a space of 2 weeks. So much skill in a space of 2 weeks, and for that I am truly grateful. So in total, generally in my surgery rotation so far, I'll just list the skills. I know in my earlier video I talked about the skills every house officer should acquire in the course of their rotation or in the course of their housemanship. So I'll just list a couple I've been able to gather so far in my surgery rotation. The first is cannulation, IV cannulation. You have to know this as a house officer. Yeah, you have to know this as a doctor. You get IV cannulation. Then there is urethral catheterization. Very, very important urethral catheterization. Once again, thoracosynthesis, also a very therapeutic procedure you need to know. Thoracostomy, very important, because like, why not? Very, very important. Yeah. Then there is, yes, very importantly, now in most of my lists here, I won't say I miss out, but like something that is very important, because like this is why we are medical doctors. It is the ability to make a diagnosis, the ability to see a patient and know what is exactly or particularly wrong with this patient, and tell the patient what it is, and then be able to prefer appropriate management or treatment for that patient. This is why you are a medical doctor. This is legit why you are a medical doctor. Do you get? So yes, make diagnosis and treat patients. And lastly, cause no harm. Well, there's another thing I feel like I learned or I got to know about in surgery rotation. It is one thing to not know about the skills. It is one thing to know the skills, to have the skills. It is another to know when not to apply them. Yes, you see a patient and you feel like this could be a possible indication for passing chest tube. Are you really sure it is a complete indication for passing chest tube? Are there other ways you could possibly relieve that fluid collection? Do you get? So yes, knowing when not to do a surgery should be one of your major skills in surgery. Do you get? Because yeah, doing a particular procedure when it is not indicated can really be very detrimental to your patient. Do you get what I mean? Yes. So yes, knowing or having the skills is not enough. You have to know when to apply it and how to apply it. Do you understand? So yes, so this is my last week in cardiothoracic surgery unit. A lot of things went beautifully actually, and usually they used to say cardiothoracic surgery unit is very chill. They don't have a lot of patients. The only thing you need to do is just maybe review your already existing patients, and then if you have any consults, you go and see with your chief and all of that. But coming into the unit, it was a totally different thing for me. Do you get? Which brings me to the conclusion that housemanship or your posting or your rotation and everything, it's actually individualized. You go there, you experience a very different thing. Another person goes there and have a very completely different experience. So my cardiothoracic surgery rotation was very stressful. Do you understand? We had patients. Sometimes we had 2 emergencies in a day, which was unusual for most people that had done cardiothoracic rotation. Do you get? So yeah, it was very, very unique for me. But still, those emergencies and those things enabled me learn a couple more things, enabled me improve on my skills as a doctor. Do you get? So I'm grateful for them, yeah, but they were really very stressful, really very challenging at the time. Yes, but yeah, I'm very grateful. And I'll be going into my last rotation in surgery. Apparently I spent 9 weeks in surgery, so that is gone. So I have 3 weeks left in surgery, making it a total of 12 weeks here. So I have 3 weeks more in surgery rotation, and I need you to guess the unit I'm going into. My last rotation in surgery. I don't know, I'm super grateful, yeah. I'm grateful that I'm finishing a part of my rotation in housemanship. I'm grateful for that, yeah. But I'm also kind of sad I'm leaving surgery. Surgery is like my one true love. I'm grateful and I'm glad that I started out with surgery, yeah. Yes, with all the initial big energy and all of that. So I'm grateful I started out with it, yeah. But then, yeah, just guess which unit am I going into. Now this unit you're going to spend, let me give you all the hints. This unit you're going to spend 3 weeks. It is compulsory. It is a compulsory rotation actually in surgery in this facility, yeah. And yes, it involves the unit involves coming in contact with a lot of, now let me not make it sound so somehow, coming in contact with a lot of malignant cases. Yes, let me put it that way. Yeah, and the unit is very tiring, very stressful. They have a lot of patients. They usually have a lot of patients. Their clinic used to last from 10 a.m. to like 5 p.m. Their surgeries they used to have multiple surgeries. You can do like 5 gigates a day. I hope it's the same in your center, gigate. So yeah, those are the possible hints I could possibly give you. And they usually have a lot of patients, gigate. I think that's one of the challenges of the unit I'm going into. So yes, with all these hints, which specialty am I most likely to get into? Yes, surgery so far has been beautiful, because if anything, my surgery rotation in Housemanship has reinforced my love for surgery generally. Surgeons are magicians, like I choose to call them. They are literally magicians, because how can you have, I don't know, I have mad respect for them, do you get? But yes, let me not conclude, because I will still go into pediatrics and OMG and then what's it called, internal medicine. But for now, surgery so far has been really beautiful for me, do you get? Sorry, I'm talking like I'm really exhausted actually, but then yeah, I had to come and do this. I've been on weekend call for the past today is Sunday. Yeah, so yeah, I've been on weekend call from Friday through till today. Yeah, so I think that's that. So yes, to my chiefs, I'm very grateful, Dr. Ainaya. Yes, that's him, for taking out his time to carry me on his shoulders. Literally, I'm very thankful for that. Yes, and also my SR too. Or SR from another unit. It's not really my SR, but still. Yeah, so thank you for getting me lunch, for getting me food when you can. I'm super grateful. So this is what I mean by working in a non-toxic environment, like in a place where you are literally appreciated and they want you to be better, like in an environment where they want you to grow literally. So for this, I'm ever so grateful. So apparently we are in the Easter season. Today is Easter Sunday, yeah. It is a season for celebrating the resurrection of Christ, literally. And Christ is the reason for the season. You get that? Yeah. Actually, it's my most favorite season of the year for people who love Christmas and all of that. Well, I was born in December, but I don't know, I just love April so much. Maybe because it is the anniversary of my parents' wedding and all of that. Well, yes, I just love April for whatever reason. It gives me the whole feeling. I don't know, I just love it. Do you get me? Yeah. So celebrating the resurrection of Christ, literally. He is not in the grave, he's risen. And I don't know, I just wanted to wish you guys the most memorable celebration, yeah, and share love as much as possible. If love to you means sharing rice, then by all means share rice, or maybe a bar and soup preferably, but yeah, add chicken to it. Sorry, yeah, well, you know what I mean. Yeah, so enjoy yourselves, enjoy your celebration, yeah, and I love you guys. So yeah, I see your messages. I needed to say this. Yeah, I see your messages, your comments on the comment section, yeah, and I'm very grateful for your comments. It's been really hard, you get, having to make these videos even while you're exhausted and all of that, yeah, having to edit them as well. It's been really stressful, do you get? But then your comments too are what keeps me going. I saw someone left a comment on my tweet one time on Twitter, and I was on X, sorry, and I was like, yeah, this is really encouraging actually. So yes, your messages, your text, your subscription as well. So yes, if you're yet to subscribe to my channel, I enjoin you to please do so. Yeah, a lot of you watching my videos too are yet to subscribe, so please do well to subscribe, yeah, and join the family. And I love and appreciate you guys, you get. And it's also a means for me to share my experience and help whomever that is watching this to to be better, literally, you get. So I think that's that. Don't forget to subscribe, and I'm sure this video has made you smile. I'm not a comedian, but still, I'm sure this video has made you smile. So yes, give it a thumbs up, and yeah, leave a hi in the comment section, and I'm sure I'm going to reply you guys. Yeah. So I'll catch you guys later. Peace.